I rise to second the motion, particularly at this moment when the 11th Parliament passed a legislation, the Human Organ Donation and Transplant Law, that really facilitates a science that cures the disease. Right Honorable Speaker, World Health Organization recognizes that bone marrow transplant or the hematopoietic stem cell transplant is a potential curative therapy. It's a viable treatment option, particularly for patients with severe disease and complication. What I should urge government to do is to improve access. Now that we have the law in place, we should have access such that for those who are sick, at least they can get cure. In access, or in improving access, we are looking at developing the expertise. Right Honorable Speaker, what we need to cure is actually cells from the bone marrow. These are blood products. The technology available in the blood banks, what we call blood banks, we can have sufficient technology to isolate some of these products that we need to actually come about with this cure. The specialist required is a human.
Dr. Lulume.
Yeah.
Thank you. Thank you very much, Right Honorable Speaker. There are, maybe my colleague would give way. He'll come back and complete. Right Honorable Speaker, I stand to second this motion, and I want to thank the mover for bringing this important motion. First of all, the public health concern about educating the masses becomes an important ingredient in managing this scourge of the disease. But the other concern is about the international agencies which have been supporting the Ugandan government. WHO, UNICEF, whose resources cannot be predictable, which calls for our government to ensure that this disease is contained. We want also to descend down into the schools, because this is where education is more important, right, Honorable Speaker? Because the boys and girls, we may not wait until they are educated by radio or TV or through any other thing, because they will start their sex action while they are young. And then you'll find them making babies without knowing or without even screening. So it is going to be important, this education to be cascaded to the grassroots level, including the schools, in the primary schools and secondary schools, before children reach to the age of the majority, so that they make decisions while knowing what exactly they are going to come up with, just in case they are carriers. The other thing is about the expense in the management of this disease and the availability of the medicines that can help to prevent the severe pain that our children go through, especially when they get attacks. Hydroxyurea is a drug of choice which has been procured by national medical stores and given the various health facilities. But you may find that many of our patients in the community may not even know that there exist such medicines in the hospitals. And therefore, it becomes an imperative for us to advocate for more resources to buy hydroxyurea to prevent those already afflicted by this disease, in order to lead a better life and to assist management of the disease better, so that our parents and children don't suffer the pain which has been described by the learned friend here, Honorable Basaliwa. I thank you very much.
Oh, thank you, Honorable Dan.
Thank you very much. Thank you, Right Honourable Speaker. I stand to second the motion, but also to tell the honourable colleagues and the country at large that as we urge government, we also have to appreciate it, because so far, currently, we manufacture sickle cell test kits in Uganda, and the Ministry of Health has brought in a new initiative of buying every child born to be tested of sickle cell. So I think this initiative, if the motion takes the day of ring-fencing the money, will help to provide the funds that will enable Ministry of Health to buy these kits now that they are locally manufactured, and enable all facilities in the country to have them at the lowest level, and train those that deliver women even at health center 3s to be able to test and be sure that the child has sickle cells or they don't, and that gradually will help us reduce the burden as stated by Honorable Basaira in his motion. So I second the motion, and I want to thank you for that.
And Honorable, not everybody knows or knew that we manufacture the test kits. That's why it is important for us to create the awareness. And maybe in the first prayer, where you're saying to recognize, we could say to further recognize the sickle cell disease as one of the major, because there are other major ones. So we could also put that. Yes, Laura.
Thank you, Right Honourable Speaker.